So you think medical billing is the job for you because it is easy, it pays well, and it affords flexibility. Well, think again. Let's deep dive into these misconceptions that can be misleading. Keep watching. Now, don't get me wrong. Medical billing is rewarding, because if it wasn't, then I probably would not have been in this profession for almost 20 years now. But reality can be a lot different than what people tell you. Most of the time when I hear about medical billing, I hear about all the glitz and glamour of what it is. You're going out on the beach, doing your job, you can just do it anytime you want, you make all of this money. This is what I hear. But in today's video, I'm going to tell you 3 reasons you should not become a medical biller. And reason number 1 is that it's an easy profession to do. Now, the perception out there is that medical billing is easy and that there are minimal requirements. And to an extent, it's right. You don't need a degree, you don't need to be certified, you don't even really have to take a class for medical billing. Because most of the stories that you might hear about medical billers, you would learn that they didn't take a class, that they were kind of just thrown into the medical billing field. And you also might hear from some of them that made it 10 times harder because they did not take a class, they did not have the foundations or the fundamentals of medical billing. And that is why I always recommend that you at least know the foundations. So even if you don't take a class, you will have someone there who knows what they're doing as a medical biller who can help you. Or if you're, say, opening up a medical billing business and you're not the one who's actually doing the billing, but you have a biller who knows what they're doing on staff or on hand, then you do that. But someone has to know what they're doing. It's not like math or English where we have learned this in school and so we can kind of just figure out what to do. You need to know what to do, because if you don't know what to do, you will be losing revenue for the provider more than you know. You might think that you're doing things right, you might think that you're getting paid the right way, but because you don't know the basics or the foundations, you are losing money for your provider, which you don't want to do. Then there are complex rules and regulations that you will have to know about billing. Each payer has their own set of rules and their own set of things that they want you to do. And you have to continue to learn what they want, what the new rule is, what the new code is. You need to learn all of that. So, medical billing is not easy. I would say it is simple, but it requires that you put in some work and figure out what you need to do. So if you want to get a jump start, I would always recommend to take a class. I'll link the video that I did above that tells you 3 ways that you can learn medical billing, but I would recommend that you use one of those ways. Don't just jump in thinking that you're going to know what to do and get overwhelmed and start to mess up, because remember, you are dealing with a provider's revenue and their money, and this is what they use to live on. So for example, if you get a job as a medical biller and you don't know what to do, you don't have any help, and you're supposed to figure out what you're supposed to do. You can't rely on the provider, because lots of billers who just jump in and don't really know what to do think that they can rely on the provider. But little do they know, the provider is relying on them. The provider wants you to figure out why this claim is denying, why this claim is not going through. What's the problem with this? What's the problem with that? They are relying on you to figure that out. So if you don't know what you're doing and they don't know what they're doing, then how are you going to get your claims paid and make them money? And the second reason is that you'll make a lot of money but not have a lot to do. Now, the perception out there is that medical billing pays a lot, it has a high salary, and that there's not so much that you need to do. So you're making a lot of money, but putting in a little bit of effort. No, 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 no. At least not for me. Every medical billing job that I had to put in the effort. And as far as salary is concerned, it depends on where you are working. Now, if you're working for a provider who is just a small office, a small practice, one provider, they're not going to pay you $100,000 to do their medical billing. It doesn't work like that. They need you to do their billing. They need you to know how to do their billing, but they're not even in the position to pay you that type of money. It depends on where you work. It depends on the specialty that you work for. There are a lot of different factors that have to come into play as far as what your salary is going to be. Then, in working a full-time job as a biller compared to maybe owning your own medical billing business, there would be a cap as far as how much you can make when it comes to working for someone else, to working as an employee. There will be a cap. So if you are maybe working for a hospital as the head, in charge medical billing specialist or something, you may make a good salary that way. But if you're working in a private practice, a small doctor's office, then most likely you're not going to make this plethora of money. So if you're getting into medical billing for that reason, I think you're going to be disappointed. And then there's the effort required for managing claims, denials, payment posting, all of those things. You might find one part easier than the next, but there will always be times where you will have to put in some effort, put in some research, put in some hard work to get your claims paid. Not every claim that you send out is going to go out clean, get processed, and get paid correctly. You will have to put in the effort. If you ever speak to a medical biller who does 1099 contracting work on the side, or maybe even started their medical billing business while working full-time, then they're probably doing that because they want to supplement their income. They want to get a little bit more. So not every medical biller makes a high salary. So if you're one of those medical billers who want to do some 1099 contracting work on the side, or start your medical billing business while working full-time, but you just don't know where to start, what services to provide, you have so many questions, then don't forget to schedule your remote one-on-one with me today. Spaces are limited. I have 45-minute and 90-minute sessions, and I can answer your questions. I know for a long time when I wanted to start my business, I didn't know who to ask. So I have these remote one-on-ones for you so that you can ask your questions and get them answered and start your medical billing business while working full-time. And the third reason is that you can work from home and with flexible hours. Now, the perception is as a biller, you are able to work whatever time of day you want to. And of course, you can work from home and from anywhere. You can be on vacation in Dubai and do your work. Now, I'm not saying that you won't be able to travel or you won't be able to work from home, but all of this, again, depends on where you work. Not all jobs are going to let you work from home, especially if you are entry level and you're just getting into billing. Actually, I wouldn't even recommend that for you if you're entry level, because you want to be around other medical billers. When you have questions, when you're just not sure about something, you want to be able to talk to other people so that you can get the answers to your questions. So working from home should not be the only reason that you want to get into medical billing. And then when you work at home, you have to have the mindset for that. You have to be able to be home and in your house and able to concentrate on your work and not concentrate on house duties and children if you have them at home, or your spouse if they're home. You have to be able to be disciplined enough to do your work as if you were doing it from a physical job. Then as far as the flexibility is concerned, if you are working for a job, most likely they're going to have strict rules as far as when you're supposed to work and when you're not supposed to work. So even if you work from home, you may be required to be at your desk from home from 8 to 5. Or even if they give you a flexible set of hours, 10 to 7, or maybe you can work 3 days a week instead of 5 days a week, you're still going to have some form of structure because they're going to need to know that you're doing your job and that you are meeting the requirements that they are setting for you. Now, let me give you a little story about myself. My full-time jobs have never been remote jobs. I've always gone into the office to work. But when I decided to do a little bit of 1099 contracting and then I moved to my medical billing business, I work remotely. I don't go into the provider's office. I do it from my home. This is something that I had heard about and I was like, yes, I can do it. I'm also a person who don't like people to micromanage me. So I'm like, great, I can do it on my time when I want to do it. But I had to shift my mindset and I had to do it quick because it was very distracting for me to come home after work and then do more work. I wanted to hang out with my friends and family. I wanted to lay down and binge watch Netflix, but I had a job to do. And it wasn't only because I had to do it after work, it was because I was home. In my home was comfortable. You have the idea of home not being work, being play, being entertainment, being all of those things. You're not worrying about work per se when you're home. But I had to quickly realize that I have a job to do. I need to stay up on my job, and these providers are counting on me. So I had to shift my mindset and realize that even though I was home, I still had to get my work done. So working remotely at your home is not always the best for everybody. Even though you might think that it may be, it might not be the best for you. So don't use that as the only reason why you want to become a medical biller, because number one, your job might not let you do that, or number two, you might not be able to handle that responsibility. If these 3 reasons are not the only reasons why you want to become a medical biller, then be sure to watch these 2 videos. They're talking about what you need to know as a medical biller. And there's a part 1 and a part 2. So I'll see you again in my next one.